Hi everyone, in the previous video we discussed about operative management of varicose veins. I am Dr. Srikanth Raju, consultant vascular and vascular surgeon, foot care specialist. In the current video we are going to discuss about what are the operative managements which are available for the varicose veins. In the olden days there used to be an operative management where you used to cut a larger incisions to do the procedure, for which anesthesia is required. Patient has to stay for 5 to 7 days in the hospital. Post procedure they have to do a dressings for 3 to 4 weeks, and they used to have an ugly scars on their legs, and the recurrence rate also was a bit higher when compared to the non-invasive techniques what we are going to discuss now. The non-invasive techniques right now what we are doing is where there is no need of any major cuts. Those procedures are nothing but like laser, radiofrequency ablation, super glue therapy, which is done traditionally in many countries. And usually I prefer to do these procedures under local anesthesia. There is no need of spinal or general anesthesia for these procedures, and these are very comfortable procedures. In the laser or radiofrequency ablation, we put a small sheath in the below knee level into great saphenous vein or short saphenous vein, and we try to put a fiber in that, laser fiber or a radiofrequency ablation catheter. And in these two techniques, when we keep such catheter, they usually have a discomfort with a pain or a shock like thing. In order to avoid that, I do an ultrasound and give a local injections around that vein. We usually have to give a 10 to 15 pricks, which are micro pricks, which are not too painful. Most of the patients usually get these procedures under local anesthesia, and the patients who have a fear of the procedure and those who can even don't tolerate that micro pain, in such patients what we prescribe is to undergo super glue therapy. Those procedures can be done with the help of 2 or 3 pricks, and those procedures are very comfortable, and there is no need of anesthesia for this super glue therapy. And following this procedure, we usually make the patient to wear the stockings for at least 6 weeks. We usually prescribe, and these procedures are very comfortable procedure. And sometimes we might use a foam sclerotherapy for small visible varicose veins in the below knee area as a local anesthetic technique only, as a coupling technique for the 3 procedures like laser, radiofrequency ablation and super glue. And some patients who have like grapes like varicose veins, with bunches of varicose veins which are seen on their calf region, in such patients what we do is we have to do a micro cuts to remove all those veins to make their leg look cosmetically good. In such patients, because we make micro cuts that will be painful, we advocate anesthesia in those patients. Those section of patients are very less, but when they want that cosmetic result of removing those veins, in such patients only we usually advocate anesthesia. Otherwise these procedures can be done 99% under local anesthesia. If you like the content in this video, please like, share and subscribe my YouTube channel, that is Dr. Srikanth Raju. In the next video we are going to discuss about the precautions what we have to take post varicose veins treatment. Thank you.